Hello there, students. I am Dr. Kanak Iyer, and we meet again after a long time. So, today we are going to discuss the OSPE of menisci of knee joint. So, here is the OSPE. So, the diagram shows interior of knee joint. So, identify A and identify B. Give two reasons for the identification. Mention the differences between A and B and give the functions of A and B. So the answers are A and B. A is medial meniscus and B is a lateral meniscus. And as we go along, you will get the answers to the rest of the things. Why do we say that this is medial meniscus? The medial meniscus is larger and C-shaped and it is placed on the medial condyle of the tibia. Now, this is the upper surface of the tibia. This is tibial tuberosity facing anteriorly and this is the fibula which is on the lateral side. So, now this is lateral meniscus. It is sitting on the lateral condyle of tibia and it is smaller of the two. Also, it is O-shaped. So, because of this reason, we identify them as medial and lateral. Alright, now little more information about menisci, which will help you to write even a note on menisci. Now, menisci are fibrocartilaginous. They are described to be semilunar in shape or also called as crescentic shape or half moon shaped if you see from above. But if you see from the side like this, it is called as wedge shaped. Wedge is one end is narrow and the other end is broad, as you can see here. The narrow end is pointing towards the interior of the knee joint and the broad end is pointing towards the periphery. Now this is a shape which is showing you everything. This is from the side where you see the wedge. Here you can see the interior of the knee joint in a vertical section. You can see the narrow edge is pointing anteriorly and the broader edge is peripherally, and it is also attached to this structure which is called as capsule of the knee joint. If you see from above, this is a semilunar shape or half moon shape or crescentic in shape. So what are the attachments of the menisci? Now each meniscus has two horns or two ends, anterior and posterior, and these ends are called as horns. So anterior and posterior horn of both the menisci are attached to the area between the two condyles, that is here. This is called as intercondylar area, which does not have the articular cartilage, while rest of the condyles are covered by articular cartilage. The anterior end of the medial meniscus is the anterior-most structure in the intercondylar area, while the posterior horn is situated in front of the posterior cruciate ligament. These are the posterior cruciate ligaments. While the lateral meniscus, its two ends are very close to each other, and here you can see their attachment close to each other, and that is why actually it looks smaller and O-shaped. Right, it is placed between the two cruciate ligaments. This is anterior and that is posterior cruciate ligaments. In addition to this, the anterior ends of medial and the lateral meniscus are joined by this structure, and this is called as transverse ligament of knee joint. The posterior end of lateral meniscus is also attached to medial femoral condyle by what is called as meniscofemoral ligament, and here you can see a part of it. This is menisco coming from the meniscus and femoral, that is going to the femur, and that is called as meniscofemoral ligaments. The outer or the peripheral border of both the menisci is attached to the capsule of the knee joint. And here you can see in this wedge shape, this is a peripheral border and this A is attached here and there to the knee joint capsule. Now proximal surfaces of these both the menisci are smooth and they are concave. Why they are concave? Because they have to fit into the convexity of the femoral condyle, and because of this concavity they join the depth of the knee joint. Not only that, it also makes femur and the tibial surface congruent to each other, and that is why gives more stability to the joint. The distal surface, that is R2 here, is flat and it is situated on the articular cartilages of the condyles or tibial condyles. None of these surfaces are covered by synovial membrane. So here you can see this is a femur, this is a tibia, and you can see here the red line is the synovial membrane. Now you know that the synovial membrane is inside to the capsule, and you can see this red line is including these four things 1, 2 and 3, 4, which are the attachments of the um, menisci. So they are inside the synovial membrane. This is capsule and this is a synovial membrane lining it from inside. So it is inside both intracapsular as well as intrasynovial. Each meniscus covers almost 2/3 of the tibial surfaces. Then it has anterior and the posterior horns which are attached to intercondylar area. Now the menisci, they bear the compression centrally and the tension peripherally. The meniscal hull are firmly attached to the intercondylar area, and it prevents the displacement of the menisci during the movements of the knee joint. The menisci are comparatively or partially avascular structures. That is because its inner portion, the narrow portion, etc., that is devoid or without any blood supply, but the peripheral area is richly supplied by the blood vessels coming from capsule as well as the synovial membrane. As far as the nerves are concerned, the meniscal horns are richly supplied by the nerves compared to the remainder of the meniscus. While the central 2/3 does not have any nerve supply, the inner regions, as we have already said, it is avascular. Now, most of the tears and injuries of the menisci are common in avascular area, but since there is no blood supply, they cannot heal by themselves. But the peripheral zones are supplied by blood, so if there is any tear here, they repair themselves quickly with the help of this blood supply. Now, the medial meniscus is comma shaped here. Its anterior horn is narrow and the posterior horn is broad. Anterior horn is the most anterior structure in the intercondylar area, as you can see, and it is anterior to the anterior cruciate ligament. We have talked about it, you can revise it. The posterior end is broad and it is attached to intercondylar area but anterior to the posterior cruciate ligament, which is here. And it is C-shaped because both horns are richly separated quite a lot from each other. The medial meniscus is also larger of the two and it has got a wider posterior end. Is the periphery of this medial meniscus is attached to tibial collateral ligament or medial collateral ligament of the knee joint. Lateral meniscus is smaller of the two. Its two horns are more or less of the same size. They are attached to intercondylar area but close to each other, so it looks like O-shaped. And the attachment is placed between the anterior and the posterior cruciate ligaments. The peripheral end of the lateral meniscus is attached to the tendon of popliteus. Now, popliteus tendon moves along with the movements, and that is why lateral meniscus is movable and it doesn't get crushed in the movements between tibia and femur. In addition, it is also attached to femur by the menisco-femoral ligaments, so that then also it gives rise to good mobility. So it is not fixed because of these two attachments. The lateral meniscus is attached to medial femoral condyle by anterior and the posterior menisco-femoral ligaments. Now, what are the differences between the two? Medial meniscus is fibrocartilaginous as well as the lateral. Medial is C-shaped while the lateral is O-shaped. Both have got anterior and the posterior end. The medial meniscus anterior end is narrow, posterior end is rounded, while lateral meniscus both the horns are more or less of the same size. They are attached to, both of them are attached to intercondylar area, but lateral meniscus they are attached to near each other, while the medial meniscus they are attached far from each other. That is why it looks C-shaped. The medial collateral ligament or the tibial ligament is firmly attached to the periphery of the medial meniscus, and that is why it makes it fixed and less mobile, while the lateral one is attached to popliteus tendon and to the femoral condyle by the meniscofemoral ligament, so it becomes more mobile. Now, meniscal functions, there are so many others, but this is one of the main functions. Now, they are inside the so they divide the joint cavity into two parts. This is the upper part and this is the lower part. In the lower part, you get the movements of rotation. So there is little bit of medial and lateral rotation which happens in knee joint when the joint is semi-flexed. And of course the flexion extension which occurs here between the femur and the menisci, that is in the upper part of the joint cavity. So we say that it increases the range of the knee joint movements. By here range I don't mean the degrees, but it is a different movement which is added to that. If you remove the menisci, then the joint will not be able to rotate. In addition to that, other main function is that it circulates the synovial fluid of the knee joint, and that is why it lubricates the knee joint. It deepens the flat surfaces of the tibial plateau because of the upper surface which is more concave, and that is why it makes it congruous and more stable. It makes the movements of the knee joint friction free and painless, gives the stability to the joint, and to the lateral meniscus bears more weight. It acts as a shock absorber. It spreads the load on the joint. Because it is supplied by nerves, it also gives a sense of proprioception, or the sense what is the movement, that is how much flex, extension, etc. That is called as proprioception. It may cushion the extremes of flexion and extension. So this covers all the questions of menisci. You will be able to write a note on menisci. You will be able to write its function or give the differences, etc. Now please listen to this video along with the using the earphones. Next time we meet with the clinical anatomy of knee joint. Bye bye.